Before we get started with the video, I just wanted to say thank you to everyone who's subscribed to me recently and has taken the time to comment on my videos. You guys have been really supportive, and I really appreciate it. If you're new, welcome. I'm glad to have you. I hope you like this video. If you do, I'd recommend checking out my playlists or subscribing to my channel. Okay, all right, let's jump into the video. You have an appointment. See you soon. Hello, this is Dr. Gabrielle calling from the Alterlife Clinic. How are you doing today? Good, I'm glad to hear. Well, I'm calling because it appears we have an appointment booked for a cranial nerve exam. Is that correct? All right, excellent. Are you still available for the appointment slot? Yeah, right now. Okay, perfect. So, is this your first time using our remote services for Alterlife? Yeah. Well, it's a great service that we offer. It's available across all of our different platforms, so for all patients and customers. It allows you to have the appointment at the comfort of your own home or anywhere on the go. All right, so in order for us to do this, I'll need access to your X chip. Okay, so in a moment, you'll be prompted to accept and to grant me access, along with a confirmation code that I'll plug in on my side. Can you let me know when that comes through? Okay, perfect. Okay, go ahead. Perfect, thank you. Okay, so we are ready to get started. Note that there will be moments when we'll be prompted to interact within the space around you. All of our interactions will be in this VR space, okay? And it will feel as if I'm there with you in person. This will allow us to do the appointment accurately, okay? So do you have any questions before we get started? No? Okay, well, if you think of anything, don't hesitate to stop me, all right? Excellent. So to begin, I'm going to ask you a few questions for our patient intake form, okay? All right, perfect. Can I get the spelling of your name, please? Perfect. And can I get your date of birth? Perfect. And your home address? Excellent. And what planet is that on? Okay. And do you have any allergies? Okay. Anything else? All right. And what species are you? Okay. Any recent health changes? Yeah, that includes like any accidents or any concussions, anything like that. Okay. Are you on any medications? Yep. List them all, please. Okay. All right. How about vitamins? Are you on any vitamins or taking any vitamins? Okay. Perfect. Have you gone through any recent surgeries or procedures? All right. Any illnesses? Right? And your reason for needing a cranial nerve exam? It was requested by your employer? Yep, no, that's common for us. In that case, what is your employer ID number? And I'll forward the results of the exam today to the employer directly. Okay. Yeah, no, just take a moment. You have the code ready? Okay, go ahead. What's their contact number for your employer? Excellent. Thank you. Okay, perfect. So that does conclude the questionnaire. Thank you. Now, are you familiar with what a cranial nerve exam is? Okay, yeah, no, I can tell you a little bit about it. So it's a comprehensive assessment used to evaluate the function of the 12 pairs of cranial nerves originating from the brain. Okay, so through a series of sensory and motor tests, we assess each nerve's function, such as your vision, smell, facial movement, and coordination, among others. The examination helps detect anomalies or deficits indicative of neurological conditions, aiding in accurate diagnosis and treatment planning. Okay, however, in your case, it's just a requirement from your employer, so we won't be conducting the full series of tests. Okay, if there are no questions, I'm going to go ahead and get started. Okay, so to get started, just going to lean in a bit here. I'm just going to check your head. Okay, can you turn your head to the side? Thank you. And to the other side. All right. I'll look for any anomalies. All right, and now your hair. Just see the texture, the follicles. Do you mind putting your head down a bit? Thank you. Just a better view of your scalp. Okay, perfect. Okay, all right. Yep, you can rest and sit back normally. Can you wrinkle your face? Yep, just scrunch your face. Okay, perfect. Can you open your mouth wide? As wide as you can. Okay, all right. So squint your eyes shut. All right, I'm going to try to hold them close together. Can you try to open your eyes? Okay, perfect. Okay, next I'm going to do a sharp or dull test. So these are the tools I'll be using. So first one here, this will be our soft tool. If you can please extend your arm for a moment. Okay, can you feel that? That is soft. It's just squishy more so. Okay. And for the sharp tool, I'm just going to be using this. It's not actually sharp, but it is pointier in comparison to the soft. So if you can just extend your arm, this is what it'll feel like. Okay. Yeah, no, nothing to worry about. So just close your eyes and you let me know when you feel something, if it's sharp or if it's soft. Okay, thank you. Close your eyes. Sharp. Yep, soft. 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 Sharp. Okay. Can you extend your arms out? Yes, please. Close your eyes still. Soft. Sharp. Yeah. Okay. Soft. Soft. Sharp. Soft. Sharp. Sharp. Excellent. Good job. Now, for this next test, I'll ask you to keep your eyes closed still. I'm going to go ahead and touch you just with the soft side, but you let me know if you can feel it. I'm just going to touch on different parts of your body just to make sure you have that sensory feeling of touch, okay? So if you feel it, just say yes. If you don't say anything. Okay. Close your eyes. Perfect. Extend your arm. Thank you. Yep. Okay, your other arm. Thank you. Perfect. Okay. All right. Just a couple more. Just want to test a few other places. Excellent. Okay, so next I'm going to test your eyes and your ears, and we're going to start with your ears. Do you have any tenderness in either one? Any inflammation? I'm just going to take a look. Do you mind turning your head to the side? Okay, and then to the other side, please. Okay. All right, so I'm going to test your hearing. I'm going to whisper a word in your ear. You tell me what you hear, okay? All right. Apple. Apple. Perfect. Sleep. Sleep. Yep. Blue. Blue. Yeah, blue. Dream. Dream. Perfect. Okay, so close your eyes. One at a time, I'm going to play a sound in each of your ears. You tell me when you can no longer hear it, all right? I'll start with your right ear. You tell me when you no longer hear it. Okay, perfect. And now for your left ear. Excellent. Thank you. Okay, so next I'm going to take a look into your eyes. Okay. All right, so start by closing your right eye. I'm going to get you to read this sentence back here. Can you read that? Now close your left eye. I'm going to get you to read this back here. Can you read that? Excellent, thank you. All right, keep your head still. Just follow my finger as it moves. Okay, just follow it with your eyes. Okay. All right, I'm going to hold up both my hands and I'm going to wiggle one finger at a time. You would tell me if you see the right or the left hand wiggle, but I want you to just look directly at my nose. We'll be testing your peripheral vision. Okay. Excellent. Okay. Perfect. Perfect. Great, thank you. Okay, next I'd just like to check your pupils. I'm going to shine a light into them, all right? Mm-hmm. Okay, now for the other eye. Okay. All right. Okay, so next I'm going to have some pop-ups show up in your vision. When you see them appear, just go ahead and click them. Yeah, just physically tap them and they'll disappear. Okay. Perfect. Mm-hmm. Mm-hmm. Excellent. Thank you. That concludes the pop-ups. Mm-hmm. Okay, so now I'm going to move on to your nose exam. So I'm going to start off with your sinuses. All right, I'm just going to put pressure on your sinuses. You let me know if there's any tenderness. Okay, thank you. Nothing. You're all good there? Okay, perfect. Thank you. I'm just going to cover one nostril at a time. Can you breathe in? Can you breathe in? Okay, perfect. All right, so next I'm going to go ahead and do a smell test. So in front of you, there will be 6 different samples, and all I'm going to need you to do is go ahead and scratch one of them, the scratch and sniff, and you tell me what you smell. Once you've made a guess, it will reveal and see if you're correct, okay? All right, go ahead. Mm-hmm. Yep. Mint. Correct. And the next one? Lavender. Correct. All right. And the next one? Cannabis. Yep. Excellent. And the next one? Chocolate. Correct. And the next one? Coffee. Excellent. Yep, that concludes the scratch and sniffs. So now I'm going to examine your mouth, okay? Can you open up your mouth wide for me, please? I'm just going to shine a light inside and look at your gums and your tongue. See if I can spot anything of concern. But that all looks good to me. All right, can you open up your mouth and stick your tongue to the roof of your mouth, please? Okay, and can you stick it out? All right, and towards the right and to the left. Perfect, thank you. All right, and can you say, ah? All right, thank you, I appreciate that. So we are almost done, just a few more tests to go. Okay, so I'm going to check your lymph nodes. Just let me know if you feel any tenderness, okay? Okay. All right. Can you put your chin to your chest? All right. And can you put your ear to your shoulder? And the other one. All right, perfect. Thank you. Okay, just a couple more tests left to do. Can you go ahead and push your head against my hand? And I'll push against you there. Perfect. Now just push your head against my hand. Okay, perfect. All right, lastly, last test. Go ahead and shrug your shoulders. Yeah, I'm going to try to push down on them as you push up. Perfect. Thank you. Excellent. So that concludes the test. I'm satisfied with the results, and I'll have your verified records forwarded to your employer directly, okay? So you don't have to worry about it. So do you have any questions before I let you go? Okay. Well, just give me one moment and I'll close out our VR session, okay? All right. Okay. You should be getting a pop-up in a moment there saying that the session's complete, that we're offline. All right. Okay. Well, all done. Thank you for your time today, and good luck at your new job. You'll do great. All right. Take care.